She was 58, a retired schoolteacher from Ohio. Healthy, active, walked 3 miles every morning. And yet, 6 months before her diagnosis, her body was already screaming for help. She just didn't know how to listen. It started with something so small, even her doctor dismissed it. A faint fullness after eating. A little fatigue she blamed on age. A bruise that took too long to fade. Nothing dramatic, nothing painful, nothing that screamed cancer. But here's the terrifying part. By the time most people finally notice something is wrong, the disease has already been growing silently inside them for months, sometimes years. If you are over 50, what I'm about to share could save your life, because cancer rarely announces itself. It whispers, it hides, it disguises itself as the ordinary aches we all blame on getting older. And the people who survive are almost always the ones who notice the whispers before they became screams. I'm Dr. Ethan Care, and in the next few minutes, I'll walk you through the silent warning signs doctors across America say are missed every single day. But stay with me, because one symptom on this list may appear up to 18 months before any cancer diagnosis. And most people feel it and blame it on stress. After 50, something quiet but powerful shifts inside the body. Cells that divided flawlessly for decades start making mistakes. The immune system, the silent army that hunts abnormal cells every day, begins to slow down. And this is where things become frightening. Because cancer doesn't appear overnight, it builds, cell by cell, often for a full decade before a single symptom appears. Take unexplained fatigue. Not the tiredness of a long day, but a deep, bone-level exhaustion no sleep can fix. Most people blame it on age, but doctors know this kind of fatigue can be one of the earliest signs that something deeper is wrong. Then there's unexplained weight loss. Losing 10 pounds without trying might feel like a gift. But what researchers discovered shocked even seasoned oncologists. Sudden weight loss after 50 is one of the most reliable early signs of pancreatic, stomach, and lung cancer. And here's the one almost nobody connects. Persistent bloating. A waistband that suddenly feels tight. Women especially dismiss this as hormones. But ovarian cancer, one of the deadliest, whispers through exactly this symptom for months before anything else appears. These signs rarely come alone. They cluster, they overlap, they hide behind each other, and most people don't realize the music has changed until the orchestra is already in chaos. Here's what hurts the most. The majority of late-stage cancer diagnoses in this country aren't caused by bad luck. They're caused by small, everyday mistakes. Mistake 1, blaming everything on age. That ache, age, that fatigue, age, that lump that wasn't there last month, age. Your body doesn't lie. New symptoms deserve answers, not assumptions. Mistake 2, skipping screenings because you feel fine. This is the one that breaks doctors' hearts. Cancer at its earliest, most curable stage almost always feels like nothing. Colonoscopies, mammograms, skin checks. These are the difference between stage 1 and stage 4. Mistake 3, ignoring changes in bathroom habits, blood in the stool, a change in frequency, stools that suddenly look different. These aren't embarrassing inconveniences. They are some of the most important early signals of colon, prostate, and bladder cancer. Mistake 4, assuming cancer runs in families and yours is safe. Roughly 90% of cancers are not inherited. They come from lifestyle, environment, and time. No family history is not protection. It's just luck. And luck is not a strategy. Now for the part that gives me real hope, because you have far more power over your future than you've been told. Start with screening. After 50, get your colonoscopy on schedule. Women, stay current with mammograms. Men, talk to your doctor about prostate screening. Former smokers, ask about low-dose lung CT scans. These tests are profoundly, life-changingly effective. Pay attention to your plate. The healthiest seniors in America build their meals around vegetables, leafy greens, berries, beans, whole grains, fatty fish, and olive oil. They limit processed meats and sugary drinks. Every meal is a vote for the body you'll have 10 years from now. Move every day. A 30-minute walk, 5 days a week, lowers the risk of multiple cancers. Movement keeps inflammation down and your immune system alert. Protect your sleep like medicine, because it is. During deep sleep, your body clears out abnormal cells before they multiply. Aim for 7 to 8 hours. And know your body. When something doesn't feel right for 2 weeks, 3 weeks, a month, don't wait. Be the patient who asks one too many questions, not the one who waited one visit too long. Here's what I want you to remember more than anything. Your body whispers before it screams. The fatigue you've been ignoring, the bloating you've blamed on dinner, the cough that just won't quit. These are not annoyances. They are messages. And the people who survive cancer are almost always the ones who learn to listen. So tonight, take 5 quiet minutes. Think about the past few months. Has anything changed? Write it down. And next week, make the call you've been putting off. Because early action doesn't just save lives, it saves the future you still have left to live, the grandchildren you haven't met, the mornings you haven't seen. If this moved you, please subscribe to Dr. Ethan Care. Take care of yourself, listen to your body, and I'll see you in the next one.